One of the very first thoughts that I had after the doctor said the words, "You have MS," was, am I going to become disabled? It's a very common response and fear for many diagnosed with MS. Did any of you have this fear? Do you still have this fear? Let me know in the comments below. Today, we're going to talk a bit about disability and if there's anything that we can do to help prevent it. I love this community that we're building here, and I love hearing from you all. I recently received a comment from Leo. He writes, "Thank you so much. I'm so much more confident now than ever before with MS." Well, thanks, Leo. And also, could you please make a video on how to prevent disability with MS? You are the inspiration for this video, Leo. In today's video, I'm going to share what I've seen in the research, how it's difficult to have absolutes when it comes to research like this, and why there's reason for hope and optimism when it comes to staving off disability and disease progression. I'm going to start with other medical news headlines that I've seen recently that maybe you have too. The American Cancer Society published a journal this week entitled "Proportion and Number of Cancer Cases and Deaths Attributed to Potential Modifiable Risk Factors in the United States." Up to 40% of cancers could possibly be prevented by diet and lifestyle modifications. The factors they included were cigarette smoking, secondhand smoke, excess body weight, alcohol consumption, consumption of red and processed meats, low consumption of fruits and vegetables, dietary fiber and dietary calcium, physical inactivity, ultraviolet radiation, and 7 carcinogenic infections. Why am I including this in a video about preventing MS disability and progression? 2 reasons. Number 1, as people with MS, we're more susceptible to comorbid conditions, so it's great news that diet and lifestyle changes could reduce the risk of these. And number 2 is, this is yet another example of newer research showing how diet and lifestyle changes can have profound effects on our health and can contribute to disease prevention and possible reversal. Last week, I did a video on brain health and newer research into how changes to our diet and lifestyle can help us stave off cognitive decline and brain shrinkage. I'll put a card above and in the description below to that video if you'd like to check it out after this one. I will circle back to these at the end of this video. Eating a healthy diet and having a healthy lifestyle is good for our hearts, our brains, and can prevent cancer. But can they help us prevent MS disability and progression? I'll get to that soon, but I want to start with medications though. I don't typically talk about medications on my channel because I'm not a doctor and I can't give medical advice. Some research shows that early treatment for multiple sclerosis could lower disability risk. It's stated that getting treatment early for multiple sclerosis could help reduce the risk of long-term disability by 45%. 45%! That's a lot. Unfortunately, this was only true for those that started treatment within 6 months of their first symptoms. This is not the norm. I had my first discernible relapse in 2006. I didn't get diagnosed until 2017. I'm curious, how many of you were put on a DMT within 6 months of your first symptoms? Let me know in the comments below. Overall, MS medications are not really great at preventing disability. They are effective at reducing relapse rates and preventing lesions, but in the long run, people with MS are still becoming disabled. There is a bit of promise showing with Ocrevus in primary progressive MS and Mayzent in secondary progressive MS, but even those are only modestly effective at preventing disability. Dr. Brandon Beaber did a video about this, and I will link it below if you'd like to check it out. What do we know about diet and lifestyle changes? We know that observational studies show good news. It's really encouraging to see that people are doing well, sometimes for years and years, by making diet and lifestyle changes. In this paper in the Neurology Journal from 2017, they looked at diet quality with respect to disability and symptom severity. They looked at the diets for over 6,900 people with MS and found participants with diet quality scores in the highest quintile had lower levels of disability. They also found that those with the better diets had less depression, less fatigue, less pain, and less cognitive impairment. And in this study from 2022, where they looked at diet quality and specifically meat consumption of over 1,300 people with MS, they concluded that results show better quality of diet, as well as not consuming meats, were associated with reduced disability progression in people with MS. And in another study from 2015, where they looked at the association of diet with quality of life, disability, and relapse rate, they reported even more details about why a better diet may help prevent disability. Emerging evidence suggests dyslipidemia may be implicated in MS outcomes. Patients with vascular comorbidities have a higher risk of disability progression. Higher total cholesterol and low-density lipoprotein are associated with worsening disability in MS patients. Eating a diet that contributes to our higher levels of comorbid conditions like high cholesterol may also contribute to our disability progression. That same study went on to say this about disability. Analysis of the level of disability among dietary subgroups found significant differences across fruit and vegetables, fat, meat, and dairy. Cross-tabulation showed trends towards greater disability among those with poorer subscores and meat and dairy consumers. Are you seeing a trend here? Those with better diet scores tend to have less disability progression. Have you ever heard or read, "Diet doesn't matter"? Let me know in the comments below. One of the things that's really impressive about the last two studies is they're part of a larger research project called the Wholesome Study, Health Outcomes and Lifestyle Intervention in a Sample of People with Multiple Sclerosis. This project started in 2012 and reviews data every 2.5 years. They are exploring prospective associations of modifiable environmental behavioral risk factors with health outcomes. The key word here is prospective. There are different kinds of observational studies, prospective and retrospective. In prospective studies, people are followed over time and data is collected. In retrospective studies, the data is collected about the past. This may be done in the form of interviews or having people fill out forms about their past. Retrospective studies have a higher degree of human error in reporting and or bias, so the results are not as conclusive. When it comes to observational studies, I really like it when I can find ones that are prospective. So, can we say absolutely that we can reduce the possibility of disability progression by X%? No, we can't. Observational studies are good, but they aren't great. They are the only kinds of studies we can do with diet and lifestyle changes on people, though. It would be unethical to do a study where some participants were given food and advice that we know may lead to harm, and it's impossible to do a double-blind, placebo-controlled study because people know what they're eating. With studies on disability with MS, it was hard to find any definitive evidence for 3 reasons. Most of the studies are not long-term. The range of disability can vary greatly in MS, so it's challenging to quantify disability. And it's really hard to get funding for large and long-term studies of this kind because they don't lead to profitable drugs in the end. But there's reason for hope and optimism. Back to the studies about cancer and brain health when it comes to diet and lifestyle modifications. The newer research is showing conclusive evidence that there are true benefits to our health. Can you imagine if a drug came out that could prevent 40% of cancers? That would be amazing. There's ongoing research into diet and lifestyle modifications and their impact on disease management, prevention, and reversal. I'm very optimistic that we will see more and more evidence in the near future that shows that diet and lifestyle changes will help reduce the risks of disability with people with MS. I've said it before, and I will say it again. We need to eat like we give a damn. Do not let anyone tell you that diet doesn't matter. It absolutely does. Having a good diet and making lifestyle changes can also help us deal with disability if it does happen. Less depression, lower fatigue, less pain, and less cognitive impairment. I know of many people with MS that have disabilities and are living well. They are living happy and fulfilling lives. Accruing disability does not mean that life is over. It means that life has changed. All of us have something we're dealing with. It could be MS, heart disease, cancer, diabetes, dementia, or other health concerns. The good news is that there's things that we can do to help us live well with them and manage them. What do you think? I love to hear from my viewers. Let me know in the comments below if you think diet and lifestyle changes can help. To see more on living well with MS or chronic illness, watch these videos next. Thanks so much for watching. Please like and subscribe and share this video. This is important because it helps to support the channel and helps it to reach more people. Thanks. Until next time, be well.